compare this experience to experience that went through for one of our other panel members here tonight, Sheila Aherne, who lost her husband suddenly at the age of 49. And Sheila, can you go back and go through your experience, the comforts and the discomforts as well?
Yes. My husband had cancer for 18 months before. He did quite well to begin with until about the last 5 weeks, which they had found had spread through his body. And the night before he was admitted through emergency, he couldn't pass his water anymore, and he went all night. So the next morning, I knew the doctor might be an emergency, so we went to emergency, and he never came home again. And one thing that was very devastating for him is at the WW Cross, they had put him on a research program with it's called a port and a pump, and thus he received his chemotherapy. And he danced with that, and he worked with that, and he went to church with that, and there wasn't anything he didn't do. He was on that port and pump for 2 weeks at a time and 2 weeks off. And they told him at the cross that he could receive his pain medication through that port if the time came. And when it came time for that to happen at the Grey Nuns, which, by the way, is only 5 minutes away from our house, so it was very convenient for us. The staff didn't know what to do with this port. And he was very devastated by that, because he was very proud that he could give something to society. And so he was very devastated by that. And but the care he received at the Grey Nuns was outstanding.
Let's talk about your situation and some of the things that Dennis and Arlene were touching on. How about the care for you afterwards?
The care for me was very, very good, because I became a Eucharistic minister, which is giving communion to the sick. So I had the full support of the pastoral care of Sister Marcia, at that time it was Father Ron Risling, and it was very good, plus St. Teresa's. I belong to that parish, and I have a number of very close friends there, so I didn't lack that part of things at all.
Dennis and I mentioned about going home and entrenching themselves again and maybe shutting things out a little bit. Did you feel the same kind of way at a point later?
No, because, no, we didn't at our house, because people were forever dropping in. They made sure we were okay.
Great. Thanks very much, Sheila. Sheila?
I would like to say I'm very happy to be where I live, and close to St. Teresa's Parish, close to the Grey Nuns, and it is it's all kinds of help is there, and it's close. It's like, it is a wonderful community all the way around. It's like a town, really, all of its own.
Sheila, good point. Marie, that's a good thought to leave on. Sheila?
I would like to say thank you for being asked to come here tonight. I'd like to thank Pastoral Care and the hospital, our church, for the for all their help. And if I could say one thing, I do work in a long-term care facility too, and I strongly agree that you have to have spirituality. In the dying, I find it's very strong. I'll have people come to me, other staff members, Sheila, come, you got to pray with these people. And that's all I have to say.